Interventions with a king. Discussion and commentary based on articles from JACC, Cardiovascular Interventions.
I'm Habib Samadi, one of the associate editors of JACC Interventions from Emory University in Atlanta. And today I have with me Dr. Shite from Kobe, Japan, who's published a very nice paper in one of the upcoming issues of JACC Interventions on the value of OCT in detecting thrombus 6 or 7 months after stent deployment. And with us also is Dr. Guayumi from Bergamo, Italy, who is one of the international experts on OCT imaging clinically. And so, Dr. Shite, let's start with you. Tell us a little bit about the background of your paper and what you were looking at.
Yeah, Dr. Otake and our colleague evaluated the prevalence and the determinants of subclinical mural thrombus in sirolimus aerating stent at 6 months follow-up using optical coherence tomography, because OCT is excellent high-resolution images and easy to detect thrombus.
Okay, excellent. So basically, you were looking to see what the determinants of thrombus was on OCT and on IVUS at baseline. Tell us about what methodology you used to answer your question.
Most important thing for the determinants of thrombus is one is longer stent. The thrombus group is around 36 millimeter, and non-thrombus is 25 millimeter. And also other factors is asymmetric expansion, which may be related to the increased number of uncovered strut and also unevenness of the neointimal thickness.
Okay. So how many patients did you study, and what was the follow-up?
53 cases are studied, and among them 40 cases detected mural thrombus. So prevalence is 26%.
Okay. So basically the 53 patients underwent ultrasound-guided stent deployment.
Right.
And then at 6 months follow-up, these 53 patients underwent OCT imaging.
Yes.
And 14 of the 53 patients, you detected thrombus.
Yes, that's correct.
On OCT imaging.
Yeah.
Okay. And so, as I understand it correctly, then the predictors of thrombus were longer stent length.
Yes.
And asymmetric stent expansion at baseline after you deployed the stents, and that was based on IVUS at baseline.
Yeah, but we look at also OCT at 6 months, so at the findings, 6 months findings also important for asymmetry.
Okay. Well, Dr. Guayumi, let's have your take on the paper. What do you think? Do you think what they saw at 6 months on OCT was thrombus?
Well, it's an important message because when you have this type of technique, they are so high in terms of resolution, you can detect a lot more compared to what we are familiar with normally with the other techniques. So thrombus is extremely nicely characterized by OCT, at least at the same level such as angioscopy that was used in the past. The problems at 6 months is when you have a minimal amount of thrombus and minimal amount of neointima, it's a little bit more difficult just to separate for sure some struts that could be marginally covered. I think the main message from this study was a first link between geometry of the stent, coverage of the struts, and thrombus formation. It means that we cannot accept that the evaluation for biological compatibility of stents is based only on the amount of neointima. It's something more complicated that we needed to understand in vivo in patients.
Okay. So the other thing that's fascinating is that you found that almost 26% of patients who undergo sirolimus stent deployment, and the stents were deployed using IVUS, 26% of them at follow-up had what you considered thrombus by OCT. That's a high number, and of course we know the clinical event rate of stent thrombosis that we're sort of trying to detect is much lower than that. And so, Dr. Guayumi, how do you put that in context, and how do you reconcile those two numbers?
So from one side, we are very happy because we started to use this technology in vivo in a larger numbers of patients. From the other side, we must be very careful because we are not at the level of a perfect tissue resolution. So OCT is extremely good for making decision on big thrombus, white and red. When you have fibrin-rich thrombus in a small amount, that could be much more difficult. So I think from one side is going to give the message that this type of technology is adding something really new. From the other side is suggesting to be careful and try to improve the methodology to arrive to have the best of the technology possibility.
Great. Well, that's a great point to finish up. We look forward to your paper and your editorial and much more work. Thank you very much for joining us.